Hello, my name is Veronica Southern. I'm a speech and language therapist in Blackpool, which is near Manchester in England. And over the last year, I've sort of reinvented myself. I've come out of clinical practice and now I work within my IT department as the clinical lead in Tele Solutions. And this is because I've developed a remote assessment tool called Tele Swallowing, which helps clinicians to link remotely to their patients in nursing homes. We have developed a pro forma, and so initially we worked with our colleagues at Blackpool Hospitals Trust, our speech and language therapist colleagues, and we put in the pro forma everything that we'd want to find out in an assessment. And that's what we do. So we have the pre-referral information. We have things like the cognitive state. We have what the problem is, the medical condition, all of those usual things. And then we go into a testing phase. So we have areas where we would give normal, just plain fluid or thickened fluid, and we'd record there very carefully what we're giving and the reactions to that, the swallowing reactions. So we do that, and then we also record our recommendations. When we were trialling TeleSwallow, we trialled the normal delivery, face-to-face delivery, against the TeleSwallow, and we found that there was almost 100% inter-rater reliability on food and fluids. And there's only a slight difference of half a scoop of the amount of fluid we would give traditional assessment versus TeleSwallow. If a referral comes in from one of the nursing homes we're linked into, then we would just take it as a normal referral, but we would do it remotely.
Okay.
So we've had patients with dementia, stroke, and non-specific deterioration going on. Polycom is a system. I suppose it's like Skype, but it doesn't go down a public network.
Right.
Polycom enables you to reach your patient remotely, but with diagnostic clarity view and audio,
Okay.
and moreover, it is secure.
Okay.
So the data is encrypted,
Okay.
so that I know as a clinician that yes, I need to see the patient and hear them, but I need that data to be secure so it's not going out over a public network.
Right.
We've done 2 trials, and the first one we used iPads, and if you can imagine, we were actually putting the iPad up to the patient's face fairly close, and no one objected.
Oh wow.
I mean, we thought that there would be, but no one objected. In the second trial, we used laptops with removable cameras, and I did that on purpose because I just thought if I was going into these nursing homes, I'd like the device to have more usage than just teleswallowing. So I don't know if you use this over there, but we put in step-by-step software and React2 software so that the patients could have communication therapy as well.
Wow.
I do have little ideas about perhaps a body-worn or a face-worn device. So maybe some spectacles with a camera, but we'll see. The software is just Polycoms. This approach, tele-swallowing, is just your normal clinician with all their wonderful skills, just reaching the patient where they normally are in the nursing home, but via a different route, and that's just the Polycom route. That is that conduit there that we can put our skills over and that is safe and clear.
Okay.
And that's it. It really isn't very difficult.
Okay.
I'm just like every single other clinician that really wants to help but has a huge caseload or a waiting list. And one day I just thought, really, it's not fair that all these wonderful people with swallowing problems are waiting on a waiting list. And you know, when you have one of those moments of clarity and you think, I've got to do something, it's got to be me that does something here. And that's where I just put swallowing problems together with technology. And I know it's a quite a complex subject, dysphagia, but I thought something could be done. And it is literally from those thoughts that I got this idea of just putting skills and the technology together, and we've created Tele Swallowing. So if I can do it, everybody can do something here.
So did you say you came out of retirement?
Say again?
Did you say you came out of retirement?
How old do you think I am?